Hello everyone and welcome to week number 9. We are slowly closing in on the end of this quarter, and this week for number 9 we're talking about medical emergencies. So this is the fun week when you only have one chapter to focus on, and that's going to be chapter 43, which is assisting with medical emergencies and emergency preparedness. So let's go ahead and jump on into this. So chapter 43, like I said, is talking about medical emergencies and your responsibility in those situations. As a medical assistant, you will need to be trained in those areas to make sure that you're prepared. Anytime there is an emergency, it's really important that you understand that you have to notify your physician immediately. Then, depending on the severity and the situation, you may need to contact some other emergency services, such as emergency medical responders, emergency medical technicians or EMTs, and advanced medical technicians or even paramedics. So if you know that you can't handle the situation on your own, know that you can always call other individuals to come help you. You don't have to do everything alone. Now, when we start to talk about medical emergencies, we need to discuss what we call the Good Samaritan Law. Now, this probably isn't the first time that you've heard me speak of it. I know that we talked about it in Module 2 when we talked about bloodborne pathogens and OSHA, and I'm sure that you've talked about it a few times in your lab courses. So this is just bringing more of that topic and more of that in-depth conversation on the Good Samaritan laws. So this is essentially a law that was established to encourage healthcare professionals to volunteer in emergencies without the fear of financial liability. This generally will apply to situations both inside and outside of your medical office. So know that you can always help somebody without the fear of them suing you and you being financially responsible. Now, as a medical assistant, we have 3 legal primary responsibilities in any sort of an emergency. The first one is a duty to act within our scope of practice. Remember, you are accountable for yourself, your employers, and the public as a whole. So if you know that you cannot do something, don't try to. Remember, working outside of your scope of practice could cause more harm than help. The second responsibility is to ensure that you document the consistent emergency readiness of your office in which you work. Having that updated training and making sure that you know the policies and procedures for any emergency is very necessary. And finally, the last one is to do all that you can to prevent emergencies in the future. For example, creating emergency prepared plans and making sure that they're in active use. Now, there are some guidelines to helping and providing during emergency situations and providing emergency care. As a medical assistant, you must stay up to date on emergency plans of your office or facility and the community as a whole. You may also need to be able to handle emergencies that come in 3 main situations. Either over the phone, if a patient calls you and says that there is something happening at their home, you have to be able to help with that. This is probably the most common of the 3, and this is where we have triaging skills that come into play to really help us during these situations. You can also have an emergency that happens near your medical office where you're training and those patients may be coming to you for training, or it could happen in the facility itself. All 3 of those are things that can happen and you have to be prepared for them. Now, every doctor office will have what we call an emergency crash kit, and it will be available for all situations. It will contain supplies that may be needed during an emergency, and it will be instantly accessible to anyone in the office. It's typically on a large roll-around cart that can be easily accessed. With this crash cart, you need to make sure that you're checking the medical box and the drug box very often or on a regular basis, and restocking it after every use. The provider is really the one who gets to decide what drugs should be on the cart, but if you do use something, you need to replace it so that way there is enough moving forward. Some of the drugs that you may see on there are activated charcoal, Benadryl, epinephrine, insulin, lidocaine, nitroglycerin, and a normal saline. So now let's get into some of the more fun topics to discuss and really talk about medical emergencies that you could encounter. Now your course and your lab course should have individuals coming to teach you CPR and first aid. So I'm going to let those individuals kind of take that one and teach you those more in depth than I can. But I want to talk about respiratory distress, chest pain, and shock. Respiratory distress could be a reaction to a long-term disease such as asthma or COPD or an allergic reaction. In an allergic reaction, it's typically called anaphylactic shock, and this happens after a medication interaction has occurred. Now, as a medical assistant, you need to be able to recognize the signs and symptoms, such as acute anxiety with gasping breath, bradypnea or slow breathing, or even tachypnea, which is fast breathing, cyanosis or turning blue, or failure for the chest to rise and fall. If this happens, you need to make sure that you administer oxygen to the patient as soon as possible. Chest pain is typically a heart attack, and heart attacks are the leading cause of death for both men and women, so it's really important that you catch these quickly. Some of the signs and symptoms are pain in the left or the middle of the chest, described as a sharp, stabbing, crushing, squeezing, or aching pain, and it may radiate to the left arm, up the back, or up the neck. Now, if a patient calls you and they're at home complaining of chest pain and you think it's a heart attack, keep the caller on the line, ask a coworker of yours to call 911, and stay on the line until EMS services do arrive. And the last one I have to talk about is shock. And shock is a collapse of your cardiovascular system. It's caused by insufficient cardiac output. And knowing the signs quickly can help you better treat that patient, such as weakness, rapid heart rate, cool clammy skin, confusion, unresponsiveness, or even nausea. Now, I want to talk about some first aid emergencies that you could encounter. And first aid is really the assistance given to any person suffering from a sudden illness or injury, with care provided to preserve life, prevent conditions from worsening, or even promote recovery. Some situations you may offer first aid to patients who are bleeding, have open wounds, have soft tissue injuries, or even burns. So I want to talk about those a little bit further so you get a better understanding. Now, with bleeding, that can be either external or internal. External bleeding is easier to spot and see because typically the skin is broken and you can see the blood pooling. This type of bleeding can be controlled. If you come across somebody who has external bleeding, apply a pressure bandage around the injured part and maintain pressure on the site. If, however, that bandage that you have has blood seeping through it, do not remove the first bandage that you put on. Just apply more bandages. Internal bleeding, however, occurs when there's tissue damage to the intact skin under the underlying organs or within their internal system. This is unlikely to be diagnosed in a medical office and is very hard to see. It only can be really viewed with image studies, and they need to be treated immediately. They need to go to a hospital. Then we have open wounds, and these are seldom life-threatening unless they penetrate your head, chest, throat, or abdomen. If those occur, you need to contact EMS right away. As a medical assistant, one thing that you can always try to do is control the patient's bleeding, so applying that pressure bandage again. And most of the time, if the injury is not life-threatening, it will require what we call irrigation and debridement, so cleaning it out and getting out any of the unwanted pieces, as well as using sutures and antibiotics. For open wound care, you want to make sure that you apply a dressing that is sterile, covering the place directly over the wound to absorb any blood or other bodily fluids. Apply the bandage with a strap of binding material so that it can hold it in place. For example, either rolling gauze or elastic bandages. Then we have soft tissue injuries. And, these are pictures of what we call open wounds. So abrasions are more like road rash or just kind of like a scraping on the skin. They don't really go much farther than that. An incision is where the edges of a cut have clean, smooth edges, typically because they're made with a knife or a scalpel. An avulsion is actually where skin has been ripped away, typically meaning that we have to sew it back on. And then a laceration is where a cut has happened with jagged or unsmooth edges, typically due to tripping, falling, or some other sort of injury. Now we have some soft tissue injuries, and this is trauma that involves both the skin and underlying tissues. For soft tissue injuries, you want to elevate the body part that is injured. You want to put it above the heart to reduce the swelling, and apply a cold pack. Now, if this injury is more severe, make sure you immobilize the body part as best as you can. Then we have burns. And burns are a type of injury that occur when an area of tissue is destroyed by the actions of physical heat, chemical activity, or high electrical current, or even heavy exposure to radiation. The severity of a burn depends on the amount and the depth of tissue injured. When treating burns, you want to use cool water to soothe the area if there is no broken blisters. If there are broken blisters, do not use this. Burns should be dressed with a dry, sterile dressing, and pain should be managed with injectable medications only if ordered by a provider. Alright guys, this is where I'm going to leave the rest of the chapter up to you to review. Again, you should be having a facility come out and teach you first aid and CPR. One last thing that I do want to talk about is emergency preparedness, and that's knowing how to respond in the event of a disaster. Now, this could be human-caused or nature-caused, and we have to deal with what we call FEMA, which is a system that goes out during disasters, and they actually consider that the #1 disaster that we have here in the United States is actually a flood, which kind of sounds crazy because you would think it would be a tornado or an earthquake, but floods happen more often than those things do. So you can read a little bit more about this in chapter 43 as well. But let's talk about your homework for this week. So this week is a special week because, again, you do not have a discussion post. Instead, what you do have is one written assignment and one quiz. With your written assignment, it is a case study about medical emergencies, and there is a worksheet that you will need to download. Once you download the worksheet, there is a brief scenario at the top talking about your patient coming into an urgent care, and she's got some different things going on. So you want to read through that scenario and then answer your questions that are below on the worksheet regarding the case study. So make sure that you're actually reading the case study, not just going right into answering questions, okay? One of the big things that you need to include is you need to still do your APA in-text citations and references. That is a good portion of this grade, so please make sure that you are actually putting in where you got your research from, okay? And then you do have one quiz this week. Again, it's 20 multiple choice questions with a 30-minute time limit. Both your written assignment and your quiz will be due on Sunday, September 3rd by midnight. If you have any questions, guys, please make sure that you're reaching out to me either via course messaging in Blackboard or my direct line at the Rockford campus. And I look forward to reading all of your medical emergency cases as they come in. Have a wonderful week 9, guys. Bye-bye.